All right, let's get things going. Hello, everyone. Welcome to our info session today on health informatics and health services management for the fall 2026 term. My name is Mashur Chaudhry, and I'm the manager of recruitment and sales for the Chang School. Before we get started, I'd like to acknowledge the land on which Toronto Metropolitan University is built upon. Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. I thank the Indigenous people of Turtle Island for their efforts to protect the land, and I deeply regret the past injustices they have endured. As Toronto Metropolitan University seeks to move forward in partnership with Indigenous people, I pledge to foster an environment that is more inclusive and welcoming of Indigenous people from all communities. Now let's go over a few items so you know how to participate in today's session. Your microphone is muted throughout the event so as not to disturb other attendees or the presenters. For the hearing impaired, we have automated captioning available, which you can access by activating it in the toolbar at the bottom of your screen. And you can submit your questions at any time by typing them into that question box. We'll collect them throughout the session and address them during the Q&A portion. Now, before I invite and introduce our guests today, I'd like to do a quick poll with everyone just to see the temperature of the room. And yeah, so if you can just take a couple of moments to answer these two questions, one being what motivated you to consider this certificate today, career advancement, career change, skill building, or current role, personal interest, and other. And then what is your current level of familiarity with the field? And you've got high, where you're well informed about the program, moderate, where you have basic awareness, and low, where you have minimal or no prior knowledge, which is totally fine, which is why we're here today. So we'll leave that on for just a couple of more seconds, and then we will introduce our esteemed panel today. All right, so here are the results. Career advancement and career change being the leading ones for the motivations of the program. And we have a mix of moderate and low, which is always consistent with our other programs. So thank you all for sharing and providing that feedback to our team. And now it's my pleasure to introduce our panel today. First, we have Dr. Priya Nipik, Associate Professor, Interim Director of the School of Health Services Management, Chair of the Health Services Management Department, and also Academic Coordinator of the certificate at the Chang School. Next, we have Lisa McKenzie, Director at the Canadian College of Health Information Management. And we also have Dr. Abbas Zafar, physician and digital health leader with 20 plus year of experience in the field, who has also taken this certificate in the past. And now I'll invite Priya to provide a brief overview of the certificate. Welcome, Priya.
Thank you. Thank you, Mashur. So everyone, thank you so much for attending today. And I'll just begin by giving you an overview of the two certificates that you guys have come here to learn more about. So just as a brief overview of what we're going to cover, first we're going to look at what the program looks like at a glance. And then we're going to move into some of the industry trends, and then more specifically and related to the certificate into the course delivery and topics within the two health services management and health informatics certificate, and then explore some of the career outcomes and learner benefits will be covered by Mashur because he's far more familiar with all of the resources that are available to you once you become a Chang School student enrolling in any of our certificates. So, and then I think too, as well, to go through how to enroll with you guys. So we're just going step by step and giving you a little bit brief introduction to everything. Thanks. So the two programs that you're here to explore and learn more about, one is the Health Informatics Certificate, and the second is the Health Services Management Certificate. So you'll see right in the top, following along, that the Health Informatics Certificate is displayed with the Health Services Management below. And you'll see that there's quite a lot of similarities in terms of the delivery options, which is fully online for both certificates. And both certificates offer or have course credits that are 7, and all of our courses are degree level credits. And there are 7 courses required for each of the 2 certificate pathways. And the length is where we start to see a little bit of difference. And the length for the health informatics certificate is 1 year versus the length potentially for the health services management certificate can be 8 months to a year. But I do say that you can, with special acceptance into a pathway that will allow you to take the health informatics certificate in roughly the same amount of time as the health services management certificate. So it can be done. The costs are quite similar between the 2 programs as well. And the reason why you see that it varies even slightly is because you will be taking 4 core course offerings in either of the 2 certificates and a variety of different elective options. And it's those elective options that you select between either of the 2 certificates that you choose that will determine those variations in costs. But for the most part, all the core course offerings are obviously all the same costs, and it's where you're selecting your electives across a variety of different program areas, which are meant to provide you with a little bit of extra expertise in specific areas. Project management being one of them, statistics being another one, just to name a few. But we are opening the floor to questions afterwards, so feel free to ask any related to the individual course offerings. Yeah. So the industry trends, I think, is what's most important, given that a lot of you guys are doing this for career change or advancement. And so at the health informatics field, as to the healthcare field on its own, which is meant to serve the health services management certificate is meant to serve, is an industry that is growing really, really rapidly. And there is a significant amount of expertise specifically required for each of those 2 pathways, which you'll see below in terms of the variety of different applications. But within the field of health informatics, which is also growing just as rapidly as that of the healthcare sector on the whole, requires a significant amount of expertise in IT, healthcare management, data analytics, policy, privacy, and security, just to name a few areas. I mean, just the overlay of artificial intelligence within the field is going to create a number of different areas that you can specialize in. And as well, too, given that there is increased privatization in the sector, the healthcare sector itself has become quite, let's put it this way, a split of both public and private options for individuals who are pursuing pathways in the field. And let me tell you that the expertise that you'll get from these 2 certificates will help you to navigate each one of those 2 domains. So to name a couple of the applications, oh, should I? Or I guess I was just going to go through a couple of them, but you very quickly, as we said, the AI applications are available, which are very useful for predictive approaches to preventative medicine. There's data analytics, cybersecurity, interoperability, genomics, and virtual reality, which are just a few of the areas of specialization, which is in health services management. You can see some crossover specifically between the data analytics portions, but for the most part, it's policy. It's issues related to accreditation, which are regular cycles that you have to complete, evaluation, quality improvement, human resources, financial management, ethics, to name just a few of the key areas and applications. So I think I'm good now. Yeah, so back to our courses again. So the courses include the skill-based learning in a variety of different areas. So what we're focused on right here is the learning outcomes that you'll achieve from the courses, which are foundational concepts and applications in the fields, computers and networks, information systems and design, interoperability, human factor impact, information systems in hospitals and community care, as well as a clear understanding of virtual care and its role in the larger system. Consumer and public health informatics, healthcare systems, electronic health records, a clear understanding of the role that they play both in managing the care and well-being of individuals as well as right down to reimbursement for services. Machine learning and artificial intelligence, trends in the field which are constantly evolving, management principles, human resources management, and ethics, privacy, and security, as I mentioned in the other slide when we're covering the applications. So those are outcomes after taking either or of our two certificates that students are expected to leave with. Yeah. So I think that when we're talking about getting a specific type of education, the next thing we're talking about is, well, how do I apply this in the sector? And where exactly will this take me in terms of career opportunities? And so these are a number of titles that we selected to help people when they're searching for credentials that will require them these particular types of certificates, like the Health Services Management or the Health Informatics Certificate. And some of these titles, um, these are the areas that people will land after getting this particular type of training. So in health informatics, there's titles like decision support analyst, clinical informatics analyst, clinical informatics specialist, quality improvement specialists, health informatics analysts, health data analysts, medical informatics analysts, and analytics managers. So a lot of analytics is tied to health informatics, which essentially is using the variety or copious amounts of data for decision-making purposes. So that's why there's a lot of analyst roles involved because there's a lot of data and a lot of different between the clinical and administrative data that's available in healthcare. There's so many different areas of specialization that this data can be used for decision-making purposes. And in the health services management sector, there are a number of different titles which are similar to some management roles in other domains, like executive director, mental health lead, operations managers, healthcare managers, patient safety consultant, quality improvement managers, screening managers. So yeah, just those are just a few of the titles that people can pursue after completing one or both of the certificates, which we have had people do both. So thanks. So I think I'm going to pass this on to you now, Mishra.
Awesome. Thank you so much for providing that overview with us, Priya. And we're always happy to have you. So yeah, just to talk about some benefits that you get as a Chang School learner as soon as you enroll with us. You will get academic and career advising from our advisors. You also have a chance to attend networking events, panels, and and you have a community of working professionals that you're taking your courses with, so you can make some industry connections there. It's as we mentioned, it's flexible online learning, and you have dedicated academic support for that. Um, Full access to TMU and all its resources, so library, learning resources, and other privileges across the university. And both of the certificates are OSAP eligible, so you get some financial support there and also some awards and bursaries that are available once you enroll into the course. And yeah, so if you're ready to take the next step, please connect with us for a one-on-one advising session, or you can visit our website at continuing.torontomu.ca and enroll right away. And if you want to contact with me directly, you can email me at mash.chaudhry@torontomu.ca. So now I'm actually delighted to introduce one of our industry experts, Lisa McKenzie, Director of Canadian College of Health Information Management and a passionate advocate and champion of health information management professionals. Nice to have you, Lisa.
Thanks so much, Mash. Great to be here. Just wanted to pop in. I am a very proud alumnus of the Toronto Metropolitan University's Bachelor of Health Administration program. So I love to be able to come in and chat with folks who are interested in coming in through these pathways because I see the value. There is a huge value in the content of these programs. And a lot of what I did in my bachelor program actually are covered off in these two certificates. So I covered off a lot of the material that you would be doing if you decide to do one of these or both of these certificates. So working in industry, I came from the Newfoundland and Labrador health system. I worked with health informatics folks, analytics. We did a lot of health information management type functions, and you really do get the really important information in these programs to help you in those roles. And now in my role, I keep calling it new. I'm about 2.5 years now in this role as the director of the Canadian College of Health Information Management with CHIMA. I see that there's so much interconnectedness between health information management and health informatics, and of course, health services management. So definitely think that this is an incredible program opportunity for people who want to get into the industry and learn about these types of things. So I'll hand it back to you, Mesh, unless you've got any questions specifically for me or Priya.
Awesome. No, thank you so much for sharing a little bit of your perspective and your journey into the sector and before when you were taking the bachelor's. Now I'd like to introduce our next guest speakers, who is also our industry expert, Dr. Abbas Zafar. Abbas is a physician and digital health leader with over 20 years of experience spanning clinical practice, health informatics, and digital health transformation. He holds an MD and MPH and also a master's in health informatics from University of Toronto, specializing in clinical data science, augmented intelligence, and clinical decision support system, and is a strong advocate of personalized medicine, delivering the right intervention to the right patient at the right time. He also leads initiatives focused on building a scalable, personalized medicine ecosystem using artificial intelligence, machine learning, predictive analytics, and clinical business intelligence. And he's also taken the health informatics certificate here with us in the past. Welcome, Abbas. If you could share with us a little bit about your journey as well.
Sure. Hello, everyone, and nice to meet you all, Mahesh, Priya, and Lisa again. Yeah, you almost said everything. So, yeah, as a physician, when I came to Canada, so I didn't like not that much to pursue my medical licensing as I realized that healthcare system moving to digital world in that time. And we can see how much is right now we are digitizing our healthcare system. So, and I was lucky to meet Priya at the early year I came to Canada, and she encouraged me to jump in this field, and I really appreciate. And I started health informatics certificate, the same thing we are presenting to you today, because for let's I say why I came to health informatics, then I tell about why I select TMU. For
Absolutely.
four reasons, I came from clinical field to health informatics. When I was looking for alternative pathway as a clinician, as I said, I saw that lots of growing in this field, and there are lots of opportunity. If you're looking for other common alternative careers in the health and from health field, their field is limited about research, about policy or something. Each of them are rich and well established environment. But health informatics or digital health is so broad. Everybody with any background, you have technical background, you have nursing, dentistry, physician, you are IT guy, you are programming, you have quality improvement, you are project management, anything. You can jump in this field and they are welcoming because it's a very big field. And that was I choose this field and I selected TMU because it's unique because I'm almost involved with all health informatics program in all Ontario academic institutes. TMU Health Informatics Certificate is unique because it's provide you a list of courses you can pick up. You can design your pathway for this certificate in TMU. And it's up to you. You are wanna lean on more technical, lean on more policy, on more healthcare. So it's up to you. Based on your background, you can customize your pathway. This is amazing. And it was very more virtual, more evening time. So for my scheduling at that time, it was fantastic in comparison with all other health informatics. So I came to TMU, then moved to UFT, then jumping on AI, lots of AI project, Flowship, and I'm here now.
Brilliant. Well, thank you. Thank you for sharing that. You are your experience and your journey is very valuable for everybody here that's attending the session today. Well, that ends our presentation portion, and I'd like to now open the floor for Q&A for our panel. Please enter your questions. I'm seeing them already coming in, so we'll get right to them, and we'll go about them chronologically. So the first one is, would students be working with coding programs in health informatics? So, Priya, maybe you can start with that, and then Abbas, you can maybe chime in.
So we don't currently have a specific coding program. So I think it depends on exactly what you mean by coding, but my assumption right here is that programs for coding of health information, that's what is coming to my mind. And so while you're not going to be, there is actually one application that you will use for learning, or let's put it this way, to get a really good idea of what coders do in terms of the platforms and resources that they use in our one coding course that we do have, which is CHIM 303. So we did just switch platforms because I mean it looks like the industry has switched platforms. So that was a pretty big transition that we experienced in the course for this spring summer term. But it also reflects the fact that we are trying to be as current and relevant that, so that when students do grad or finish our certificates and graduate from them, that when they go out to work in the field, that what we teach them to use, that they will be using in the field. So I apologize if you did not mean coding in this particular way, but you meant coding of particular programs, because we don't see much of that in the health informatics certificate. So just in case.
Oh, yeah, I think you are on the right track there, but if not, please let us know, and we'll be happy to get you that answer as well.
And Anabas has, I think,
Yeah.
something he wants to chime in and add. I
Yeah,
appreciate it.
so as Priya mentioned, coding has a different spectrum. So if you are coding on health information management, this is expertise of Lisa, so she can explain it. It's totally different. But if you are talking about coding programming, more technical something, Python, R or something like that, I'm not sure if any of the current module or courses touching that one, but my recommendation is when you jump in this field, definitely with this new era of AI, you should learn vibe coding. I learned by myself several years ago. I totally forgot Python everything. But in last months, I developed four applications, software by myself with ChatGPT, with vibe coding. No coding required. So this is the new skills. This is the new era that if you like to jump in this field, this is another skill that you should consider.
That's
Yes.
such a good point, Buzz. Thank you for mentioning that. All right. Next question is from Nivetha Siva. Thank you for your question. And the question is, healthcare organizations often have the technology and data, but the challenge is getting people to actually change how they work. And does the certificate prepare us to bridge that gap between technology, people, and sustainable change?
Yes, so we actually used to have two courses and we're bringing one back, but we do currently have CHSM 305, which definitely will cover. That's our healthcare management course, that our general sort of change management course that will definitely, you'll see so many different facets of how to address change management and all of the key barriers and facilitators to change management. There's so much more going on in that course now too, because we just recently redeveloped it. So all of our core courses are either currently going through redevelopment or a redeveloped version of them is going to be offered in the fall 2026 term. So I myself have to dust off all of those expansions in what's covered because I just superficially have grazed some of the content areas, but that one for sure is covered.
If I can comment,
Yes, absolutely.
that person asked this question, you exactly point the purpose of health informatician. I always tell my student and mentees, health informaticians, they are bridge makers. They are bridge makers between the island of clinicians and island of technical guy. They are talking in different languages. They can understand each other. And health informatician people make this bridge, transfer the knowledge of this side to the other side. This is exactly that you should do when you coming in health informatics.
Lisa, anything to add there?
No, I think that's a fantastic analogy, both in health information and health informatics. Really, we are the translators. We are the ones who bring the two pieces together. So, definitely think that's a great analogy for sure.
An important point that I think emphasizes as well the whole idea that Abbas said out the gate that you can come from so many different disciplines of knowledge and transition into this field because there are so many skills that are required to, yeah, and so many different roles that can be performed. Yeah. Jack of all trades, magician, you've got it all. Communicator. So, yeah, collaborator. There you go.
Yeah, those are such important skills, actually. So yeah, thanks for saying that. Okay, so next question is for someone who already has a bachelor's in healthcare management, would you see a specialized certificate like this as a good next step, or would a master's generally make more sense for someone looking to begin a career in healthcare management and health systems?
So I'm going to jump in for first on this one, just because this is sort of what I'm seeing with our degree completion program quite significantly. I would say that your goals should be working on trying to get lived experience in the field, right? So build your experience because ordinarily I would say if you have an undergraduate level of training and it was recent, and your question is, how do I get into the field? I would say begin with certificate. You can apply to a master's. You don't get into the master's. You complete the certificate, but what you do want to do is demonstrate to the employer that you are continuing your education. Because, if the expectation is that you're finished and this is you've done what you're going to do and you're applying that way, within about 6 months to a year, your last level of education becomes rather dated, and even more so at the 5-year mark. So I'm not sure at what stage you are in completing your Bachelor's of Health and Healthcare Management already, but I would strongly encourage that, yes, leverage moving to a master's. But I always say put your hand into many different things. Don't just have this like one track sort of trekking along way of thinking about it. And oftentimes the certificates can give you usable skills that you can actually use directly while you're working in the field or early entry to the field. And so I'm always a strong supporter of our Chang School certificates because there's so many different areas that you can leverage and learn more about that are needed in all sectors of management, but very specifically in healthcare as well. And so I'm always saying do the certificate and have the master's in the back pocket, or, have that track already planned out by applying, because beyond that, you can't do much more, right? So I wouldn't limit your chances. I would say do it all. So, boss, go ahead.
Yeah, that's great. 100% I agree. But consider this one. I know that having master in comparison with the certificate, it improves your resume more than that. That's only one condition for your future career. Is not the whole thing. There are lots of things. How much you are expert on your resume writing, resume customization, cover letter, LinkedIn, specifically on your networking. That's huge uh, effective factor. I know lots of our MHI, Master of Health Informatics at University of Toronto, with a master from U of T. They couldn't secure a job, but some people with certificate from TMU or George Brown College, they have fantastic networking. They got the job quickly. So totally different. Master or certificate is one factor for your future career.
Go ahead, Lisa.
Great points of us and Priya. I think both of those really make a lot of sense. When you start, if you're starting off and trying to get into healthcare, it's the hands-on learning, the actual practical experience you have that will get you in through the door, and then you can start working on, getting your masters and those types of things. But one of the things I did want to highlight is the speed with which things are changing in healthcare right now. So it's exponential. It is, we probably saw things change at a relatively regular pace, somewhat slow, in healthcare in the last maybe 15 years. In the last 2, 3, 4 years, it's just been unbelievable the amount of change that's happening for master's programs. And I'm sure, Priya, you could probably speak to this. To get a master's program updated, to get your material updated, your curriculum updated, all of those things, it's not as exponentially quick, we'll say that. Whereas a certificate program, you're looking at being able to do at the course level updates to make sure it's more current. So if you're looking for currency and you want to have something that can get you working right away with the current skills you need, certificates really help you in that way. So definitely would not take away anybody who wants to go on and do a master's. I'm not saying that all the master's degrees out there are stale, but they do take a bit longer. And we know that in healthcare right now, what you learned last week is probably stale next week. So it's just really, really fast. So getting the certificate really gives you that little bit of a more current set of knowledge and skills.
I love that. Thank you, guys. That was some really, really good advice. Really helpful for everyone here, because there are other questions about, if I'm getting the certificate, will a Master's of Health Informatics be a waste of time? I think, like you guys said, it all depends on, what their goal is and where they're trying to reach. If it's employment, if it's more education, I think all of it will be valuable. But yeah.
Yeah, and we have a number of students that will apply into their Masters of Health Informatics, and when they don't get in, they take the certificate. So again, it's speaking to that whole idea that, you're constantly, it's not going to hurt you. By no means is it going to hurt you to have additional education and knowledge within that area before you end up doing a master's. And so, if that is your end goal, no one's saying that it isn't one that you shouldn't be working towards. Yeah, so definitely.
As you all know, we get these questions pretty much on all of our sessions, where people are coming from multiple different backgrounds and are wondering, if their certain background is beneficial, or if it's a right fit, or if this will help them with this certificate plus their background. And we always talk about transferable skills, which you can always bring from different backgrounds. So today, we have someone who's coming from software development and IT. We have people that are coming in from banking, economics, and then I believe there is one from project management as well. So yeah, what could you say maybe to all these people with different backgrounds and how they would be still a good fit?
So I think this is going to not be labor, I hope, Abbas, and I might just butcher this a little bit, but the idea that there are skill sets that you have in each one of those sectors, uh, the notion or the belief, or I know you will be able to use what you have in your IT business world, in the banking sector, from the whole management and soft skills of human resources. And never mind just understanding big data, because banks also have lots of data and they use it for decision-making purposes. So I don't see any of those things as being harmful in any way if you're coming from those sectors. If anything, you're going to be able to leverage your existing expertise and experience to, bring a new vision to the field, which always is welcome because when you come from a different sector you do things a certain way, and then when you come into this sector it's this bi-directional sort of learning that can happen from both people with their areas of expertise. um, while you will not learn these specific coding languages, like you're not going to be, there is the opportunity. It depends on the area that you go into. So, for example, I think Abbas mentioned Python and HL7 here, and I think that there's other things that your data standards that you're going to be like, you're going to learn about the implications of them rather than actually being a part of, let's put it this way, on the back end of those particular requirements. So I don't know, Bas, if you want to speak to this a little bit further, because I know that seen HL7 in the foundations course, but I think it was more in a descriptive sort of way. So
Yeah, sure. Uh, Totally agree with your perspective you presented. As I said, digital health, health informatics, health information management, they are overlapping a lot and so broad, as I mentioned, and you can apply definitely any of those skills and background you got gained from other sectors in these sectors. This is the most complex sector in our society, healthcare system. So all of those skills and knowledge can be applied in this field, and you can find a situation or location to apply that skills. You just need to customize and train your mindset and your skills, how you apply them in the healthcare system. So if we are talking about data, healthcare data is 1/3 of all global data in comparison with all other data sectors. And it's huge. It's huge. So definitely you can apply your previous skills and knowledge in this field.
Lisa, anything from you about the different backgrounds that people come in from and that you're seeing in your industry and in your work?
Personal experience, I came into health information management after 15 years of being a chef. You can change anything, right? You never know what you're going to be when you grow up, really. So you can bring your skills that you have are transferable. You just have to have that mindset. Think about what are my strengths that I can bring to this new way of learning? What can I improve upon? What are the areas where I need to really focus on? And look at those in your elective choices. If it's something that you really want to focus on, you pick the elective that makes the most sense for you. So definitely, there's always opportunity for no matter what field you're from, you have strengths that you can build on for sure.
So this is
Brilliant.
fantastic. I didn't know that. I will use this use case in my all classes. And
Fantastic.
definitely you use your skills to change data to information to knowledge and cook inside in your
Go.
field. It's fantastic.
Documentation. Follow that recipe. It's documentation, right? Like there's
Fantastic.
lots of ways that you can put it all together. So yeah, you just have to find what are your strengths and play to them, right? That's what helps you. So
Um, Next question, maybe Priya, you can start with this one. Do you tend to see people with more technical research backgrounds going into the health informatics certificate as opposed to the health services management? And do you tend to see nurses going into one program or another?
So we tend to see a lot of nurses taking both certificates for sure. And I mean, our enrollment, a good third of them are nurse practitioners. They're RPNs, registered practical nurses, they're nurses. I mean, we have a lot of nurses taking both of our certificates, to be honest. And I wouldn't say per se that there is a certain type of expertise that will draw someone to one certificate over the other. I think leveraging everything that we've just said, it really depends on what your individual strengths are, which are not always best represented by your roles, which Lisa just and the jobs that we have performed to date, right? Sometimes you haven't been able to even start them. So there's really not been a specific pattern that I can say that I've seen and said, oh, always when we have somebody applying that they're going to go, that this person with this type of expertise and job and work experience is going to end up wanting to take one certificate over the other. If anything, what I tend to typically see is if they take one certificate and then take electives from the other certificate, that they sometimes come back and pursue the other certificate in full, right? So that is something that I am seeing as a typically relevant and significant trend. And as well, too, I think there was a question that was a little bit further down about other certificates that people take. So what I do find if they're not taking the health cert, if they take one of our certificates, that they will then also look at our big data certificate or project management or so things where that I think there's a couple of students that have done our there's like a security certificate, which is a lot around secure platforms and like understanding like the significance of security and the various different ways that we can secure platforms. And I know very little about the certificate, as you can see, but nonetheless, that they that they will go into these particular areas. And it's only from, discussions with students that have finished our certificates where I find these things out because I'm always curious to see what other things that they want to package our certificate with and have been successful in obtaining employment doing so. So yeah, so those are the ones that stick out to me quite readily. Yeah.
No, that's a great distinction and a great explanation to how to look at it. I know there's a lot of questions about, which courses would you suggest to pursue and, what's the best pathway to take the courses for the health informatics or the health services management. What I would say, and correct me if I'm wrong, is, there are a bunch of core courses that you need to take for both the certificates, and they're not always offered in all of the some terms. So I would say start with the ones that are there in the beginning ones that are there, and then you can move and navigate from there. But yeah, anything
Yes.
else you would suggest there?
Yeah, the majority of our foundations courses across the two certificates are offered in more than one semester of a year. But there are a few elective options that you'll only see crop up once a year. And so our coding course will crop up once a year. So if it is something that you're targeting and wanting to take as an elective option, when it's being offered, prioritize it. And even if that means that you don't have the prerequisite, I reach out because we do waive prerequisites if you're taking the prerequisite at the same time. And so I just, I want students to get the, most out of their learning experience and, select the courses and be able to take the courses that they think that are going to be most helpful towards their career path. And so we are flexible and do work with students towards that end for sure. Yeah. So, and actually, I mean, over the last two semesters, a lot of our core courses are offered in at least two semesters, if not all three. So, and that's just been because demand, thankfully, has gone up in the certificate steadily. I mean, if it's any reflection of the field, demand definitely in the certificates has seen a similar sort of increase. And so as a result of that, we do have many more opportunities for students from semester to semester. You won't have an issue with getting courses, that's for sure. Yeah.
Awesome. Okay, next question is, will my practical experience as a nurse translate into the certificate? Yeah, anyone from that type of a background.
Well, as a boss, and I'm going to reiterate it again, and maybe you want to add to this, but yes, definitely your practical experience as a nurse will help. And in many instances, when there is something, and new technology is always being adopted and adapted. Okay, there you go. But it's always being adopted. And what ends up happening is, or the biggest limitation to the success of any new technology adoption is the onboarding of users. And a huge stakeholder in that transition is nurses, and along with all other clinicians working in those various different settings in healthcare. And what ends up happening is it's only as good as the champions for those particular stakeholders because, first you got to onboard and then you've got to have people who are in there championing those things for the benefits from a standpoint that would be understood by those users. So, I'm in here, I'm the informatics specialist, okay, as one role. But I have never been a nurse and worn the nurse's hat. But I need to get all these nurses to use this technology for it to be successful. Someone like you with your practical nursing experience is going to be able to pick out exactly how this is going to benefit the care to patients because it boils down to that from the nurse's lens. That's the primary, most centrally important thing. Whereas efficiency and accuracy improvements and things like that, while we'd adopt these new things, are relevant from the informatics piece. It's being able to put those two things together and come out on top with everybody, adopting what it is that you want them to do. So there is so much room. And in fact, nursing informatics has grown as one of the largest fields, like quickly and fastly evolving for this particular reason, because they are such key stakeholders and because a lot of nurses will, work in the sector as in that capacity and then want to move into these areas, like just like they have for years in policy or, in privacy. And then they're moving now into informatics, right? Because there are many places they're needed once they become experts. All of a sudden they really know what works and what doesn't. And we need them in all of these different areas, right?
Yeah,
Boss,
my
anything to add to that?
experience
Yeah.
is almost the same. We have lots of clinicians in our classes in all of those academic institutes, physicians from different specialties, dentists, pharmacists, and nurses. And as Priya mentioned, nursing informatics is a big, well-growth subsection of health informatics, very strong community. And just in my recent experience, because last year I led my UFD practicum course, so we have to find internship opportunity for our students, and the uh, quicker acceptance students were those students with nursing background in Ministry of Health and other organization. So this is my recent experience.
Lisa, anything to add to that from your experience?
I mean, nurses bring such a wealth of understanding of the health system. So bringing that compassionate view, that patient-centered focus that nurses have, really does help on the technology side because the data geeks, the technologists, the people who are not clinicians like myself, we're often not always do we have that as the top of our mind. It's more about how can we make this shiny new system work really well. And the nurses really do, clinicians really do bring that patient focus back to us. So I think it's really key in a lot of organizations to make sure that they do have that clinical view and input into any technology that happens. So again, a really great marriage of technology and clinical background.
Love it. Thank you all. So we have a few questions about getting a job, right? A lot of people want to know about career outcomes after taking the certificate, especially when they're coming from different backgrounds and they don't really know uh, which one to pick between, health informatics, health services management, and health analytics, because, we did say that there is overlap between these. So if we could maybe talk a little bit about, what that next step after the certificate towards getting the job looks like, and how can you distinguish the career focus between, the three of these: health informatics, services management, or health analytics.
So I think what Lisa said struck me most about the idea that you need to figure out what you're good at and then find a way to harness that and leverage it as you move into your next stage of education. So I would start with figuring out what your strengths are so that you can play to them. And then that'll help you determine what certificate best suits you. And this could also be a combination of, your education, your experience in the fields, just like your, personal sort of interests. If there's any intersection in those, then you want to make that your primary focus. For some people, that is going to be in the health services sector because they have some really strong soft skills. And they're really needed there. And so in various different leadership roles and management roles. But if you're playing to strengths that because you have very strong technical expertise, the health informatics, or if you have really like something as simple as my son, he's amazing in math. But if you have to, force him, and it always is, to read a textbook, it's very, very harmful. So, and it's not pretty to watch. And so when it comes to anything applied and mathematical in orientation, then he's all over it and just loves the numbers and loves the way that, they work with one another. So maybe, being in analytics or, advanced data analysis, that would be an area that you want to go and expand your knowledge in if you have these, foundational sort of strengths. Yeah. So, I mean, I think that that's sort of like first deciding what's a better fit for you and what you can leverage that you're already existing and, you can build upon. Great to know first, because then it speaks to what Abbas, who I'm going to give it over to in a second, had said. You really got to leverage your own individual expertise, because, at the end of the day, there's some people that will have a certificate and will get a job versus somebody who has a master's and will get a job, because it's really how you use your knowledge, towards that end of securing employment. And Abbas, I think you said it much better than me, so sorry but feel free to piggyback on.
Never ever. I couldn't agree more than with you. So on top of this, about the future career or opportunities, this is that I came to this field because of those reasons. First, before you apply for any health informatics program, master certificate, any of those academic institutes, search about the investment of North America, Europe, everything on this field, and recently about AI. You can see how much market is moving in that way. So this is for me is more job opportunity. This is one. The other one, if you think about other pathway, search about some job boards and compare how many related positions pop up every week, every month. In comparison, health informatics related positions, it's huge because it's broad and you just need to find which one is more appropriate with your background, your interest, your pathway, your future. And the third one, the reason I came to this area, for example, if you go for nursing or any of those alternatives, think about the organization offering job. The majority of them are limited a specific organization. Research, or for example, research field is only research centers. or any other pathways. But for health informatics or digital health, all clinics, big clinics, hospitals, government, private, EMR or vendors, AI, startups company, research centers, we have huge growth in consulting in health informatics in the last 5 years. Many of those big consulting company, when I jump in this field, they have a small team for health informatics or digital health consulting. But if you check right now, Deloitte, KPMG, any of them, they have a department for health informatics consulting. So for if you put all this together, it's a signal that this field is growing and more job opportunity is available.
Pair that with looking at federal government investments. And so, yeah,
Exactly.
that is somewhere where you're traditionally seeing increase in spending. So, yeah,
Yep.
it is going to grow and grow and grow in terms of relevance and significance. I think it's on our Bachelor's of Health Administration degree completion program website. You can see just all of these like indicators of the growth in the sector. So, yeah, Lisa, go ahead.
Just to build on some of that, we also are in a legislative development process now with the Connected Care Act that's currently being debated, I guess. So that's a huge piece. That says that vendors have to make sure that the information they hold can be shared. And that's what interoperability is. That's where you're going to get that sharing of health information that's actually going to reduce people getting harmed in the system by not having that information. So we really have legislation that's coming that's really going to expand all of these things. Because we're saying information has to be shared, we have to have people who know how to build systems that share it. And that's where a lot of these skills come. So definitely not just because we're seeing AI startups and all of these systems coming, we're also going to have regulatory frameworks that tell us that we've got to build these systems in a way that we can provide what's required. So I think that's an important driver as well.
Awesome. Thank you. Thanks so much for that very insightful answer to this question. I know we're almost at time. We've got two more questions that I think we can really quickly get to. One is there a chance that the data technical part can become overwhelming to someone without the background? And then the other one is, are there other professional exams that we can write in relation to health informatics other than just taking the certificate, anything from an organization or institution, anything like that? So these are yeah, and then we'll wrap up after these two questions.
I think we can speak to the second one about the exams that you have to write really quickly, in that there are various different CHIMA certification is one that you can pursue, and there's eligibility requirements. That's one of the reasons why Lisa repeatedly comes back, because it is an area that people will go, or let's put it this way, it's sought after. If you're looking for employment, people want people with CHIM designation. So you can sit, but you have to obviously work with the college. They will figure out whether you're meeting the requirements or what in addition to the certificate that you need to do to be able to challenge the exam uh, and become certified. The other thing is that we also have Digital Health Canada. And so Digital Health Canada has a similar sort of pathway. There is exams that you can sit for, and there's a designation that you can receive upon completion and meeting the requirements, which are a combination of education, which we meet those requirements, but then in addition, there's a certain experiential requirement too, and then you can sit for certification. The overwhelming, I think the question is more around to a dental clinical background, meaning like, is this data analysis going to be overwhelming? Well, thankfully, I would have said maybe somewhat 3 years ago. But with the inception and rapid growth of artificial intelligence, we can, and I mean this, everybody can do anything all at once. So, because what you are not strong in or what potentially would have overwhelmed you. There's so many assistive supports for those things. And I can say this with and I mean I have the experts here with greater certainty that you can do this with data. And the analysis portion, AI is very sophisticated and come a long way in terms of applications to support data analysis. So I feel very confident that people with all walks of in terms of different backgrounds can undertake this portion, the analysis portion. So understanding this healthcare big data. So and sifting through it for specific purposes and intentions.
I
Yeah.
love that. Yeah, that's great. So yeah, that brings us to the end of our session today with no more open questions, but I just wanted to say thank you to everyone for such great dialogue, such amazing questions, and from our really inspiring panel, all the answers and all the perspectives and insights that you provide. Thank you for joining us today. And if you're interested in learning more about this certificate, please visit our website at continuing.torontomu.ca. And if you want to contact me directly, please email me at mash.chaudhry@torontomu.ca. All of the information that we shared will be sent to you in the recording of this session within the next 24 to 48 hours. And on behalf of the Chang School and all of our presenters here, thank you for joining us and have a great rest of the day.
But for now.
Thank you.
Bye.
Bye,
Bye.
everyone.
Take care.